one of the things that we've already started with is what we call telehealth or telemedicine, where we can consult you at the comfort of your home over phone, video consultation. This is for very cold cases, or where you are not really in an emergency situation, maybe for a cold, a sore throat, or something not very urgent. So the doctor will make an assessment looking at your symptoms, is if it's something that you need to come in for, or you can be prescribed medication, and give you all the signs to look out for that will need you to come in to be seen. That improves accessibility. Somebody who's in a place where they're not able to access a medical professional, they can just call in or video call. And
so this is currently being offered.
Being offered. It was being offered before COVID. The uptake
during
was
COVID as well.
Yeah, and during COVID the uptake was quite high, because that time people were confined to their homes. We also did what we call home visits, where we'd go to people's homes, and that was really I'd say life-changing for a lot of people, because
that's a game changer.
We had people who could not move to certain areas, and our hospitals were really overwhelmed at that time, and we were able to go to your home and be able to assess you at home and decide whether you need hospital management or we can
offering that? That
we
sounds
do.
Like something
we
that
still we still offer home consultations, and a lot of the times we're called for people who are maybe bedridden, cannot move much, but we offer home consultations for anyone, busy executives who cannot. We can come to your office, make the time to move. And then the second level of that is, like I said, a lot of rural areas don't have these medical personnel. So we're looking into what we call a telehealth booth, where you will have that booth with all the equipment that will be operated by a technician, and you will go into the booth in the rurals. You'll go into the booth, and then a doctor in Gaborone will be able to examine you, be able to tell real time what is going on with you, and be able to take action or give an intervention.
So this means that the person who's operating this booth doesn't necessarily have to be a doctor. They just need to know how to make the machines work.
Yes, definitely.
Okay.
Yeah, like
because you've got a technician, a qualified doctor
on the other end. Yeah, definitely.
Welcome to Moving Humanity Forward. My name is Kathy Malijani. You can call me #CuriousCat, because you know what? I have so very many questions. Now, the big question today is where to next after the diamonds seem to be tapering off, especially regarding world sales and what is happening as far as our economy is concerned. We want to say that at Moving Humanity Forward, we're always looking to speak to trailblazers, we're always looking to speak to trendsetters, and certainly our guest today is exactly that. She goes by the name Dr. Matlhogonolo Mouwane. I hope I said that right. She is founder of Galafi Medical Group as well as Renewal Esthetics. And you know what? One of the things that she is looking to do, I believe, is certainly something we can take a leaf from as an entire nation. You know what? Let me actually let her give you a bit of her background herself. Dr. Matty, a very, very warm welcome to Moving Humanity Forward. Thank you for joining us today.
Thank you for having me, Kathy.
We're excited to have you, and I think it's always good for you to give a bit of context on just your journey. We want to know about Galafi Medical Group. We want to know about Renewal Esthetics. But first, let's start off with the young girl that is not even doctor, just Matlhogonolo, right?
Yes.
Take us through the journey of how you got here and how you're seated in that chair today.
Where do I even begin?
Take it from as a kid.
Okay, alrighty. As you rightfully said, my names are Dr. Now Matlhogonolo Mouwane. I'm Motswana. I'm from a small village called Marapong.
Which I didn't know where it was until you broke it down for me.
Yes, Kobokalaka. And I schooled most of my life. I was schooling here. In terms of my school, primary school, I went to about 4 different primary schools because my mom worked for the government, and so she would get transferred and would have to move, and I'd have to change schools. So I was always like the new girl at school most of my primary schooling, and I went to government schools all my life. I'm a real diamond baby through and through. And I finished my Form 5 in 2007. And, I was like top 2 in my school where I was, Form 5. And I had really worked hard and told myself that I was going to go overseas,
Yeah.
And then I go to University of Botswana, I do my BSc.
Yeah.
And
And we used to know
fortunately,
that when you do BSc,
you were gonna
then
go
you go,
abroad.
right?
That
After
was
the
the
first
dream.
foundation.
Yes.
Yeah.
Fortunately, I don't know. Fortunately or unfortunately, the University of Botswana started the School of Medicine. So
Okay.
I was like part of the first group that started the School of Medicine. And they used to call us the cream de la cream because they actually picked the top 36 students of that year
Okay.
to start the school, which was smart. I mean, and then the rest of the students were posted to other universities outside of Botswana.
Yeah.
They started with a small number, I guess, just to see how it will go. And then I think now graduating maybe 80 doctors per year locally,
Wow.
which is a great milestone. I'm not
Yeah.
sure about the number, but yeah, the number has increased over the years. And during that time, it was such a tough time because there were a lot of, I remember when we started, people were curious about how we're going to learn medicine. Are we gonna have cadavers?
I
Cadavers are,
remember there was a
yeah,
big story
that
about
big
cadavers. Where
debate.
are you getting your
Yeah,
cadavers
other
from?
people in
Where
other
did you get your
countries.
cadavers
We
from?
did
Tell
not
us.
use
Okay.
cadavers, unfortunately. We
Okay.
used models,
Okay.
and people were also, there was a lot of talk around that as to like, are we really gonna come out?
Yeah, because you're not going to use
Great,
cadavers.
yeah,
You're
because
going
we're
to
not
have
gonna
models.
use cadavers, but it was good because other universities all around the world like we're moving towards using models as well.
I'm trying to find the polite way to explain to the viewer what a cadaver is.
Maybe
In
I can,
layman's
yeah,
term,
in
please
layman's
help.
term, cadaver is, okay, when you die, you donate yourself. Like most countries, when people die, they donate their bodies to the medical fraternity for the advancement of medicine.
Yeah.
So you donate your body, so your family will not bury your body. Rather, it will be given to an institution, be it a university or a hospital, to use for medical education.
And that's important for the course because as a medical student, you need to know the human body. And so that's why it's part of the
Yeah.
course.
So it's better to practice on
An
a,
actual.
a dead body than to practice on a live body at a certain point, like
Yeah.
when you're just starting out and new to it completely. So yeah, there was that whole debate about whether we're even questioning whether this is gonna be great. There was a point where they were saying the school was not accredited.
Yeah.
And at some point, I remember third year, I almost just quit, like, oh, this
Why?
is too
What
much.
happened?
No, just all of that, like
The
not knowing the
pressure.
future, like not knowing if we're gonna graduate and if we're gonna be hireable anywhere else in the world. And I must say, like, all of my classmates are doing amazing. Like, we have some of my colleagues all over the world, and it's something that we used to worry about, to say, are we going to really be a recognizable institution? And I must say that University of Botswana School of Medicine is one of those.
Yeah.
So fast forward, graduated in 2014 and did my internship. So you do internship for a year, which is part of the University of Botswana program, and during that time you are practicing but under supervision. And then post that you get posted to a facility anywhere in the country. So my first post was to Pitsani Molopo, which was a village, and that was.
Do they have a full-on clinic there, or was it just
It
like a
was, yeah, it was a
primary?
clinic. And initially when I got posted to that place, ooh, I was so devastated. Like I'm just starting out in my career, and I was the only doctor there. I was
Yeah.
working with midwives, and all of them were older than me, but I was the most senior person, young in my early 20s, you know. Um, and I must say that was a very defining time of my life. I call it the making of me, because during that time, that's when I got to really discover myself and, in terms of career direction, which way I want to go, and all of which that I am now was motivated around and cultivated around that time, because I was thrown into the deep end, having to take on a leadership position at a very young age, having to manage a whole facility. Thought that was a whole I don't want to say district, it was a whole cluster. Yeah, having to take on a cluster, because I would visit other villages around that area. And I remember when I got to Pitsani Molopo, the third road ends at Pitsani Molopo. I don't know if now there's been, at the time, like you get to that place, that's the end of the third road, and I'd have to visit like the outskirts, going to Bomabul and deeper places in that cluster to see patients there. So that really, during that time, I really got to witness um, the effects of an overstretched public healthcare system. Because I remember one time, I got a client or a patient who had collapsed, and one of the things that you should check is check their sugar levels to see if they're low or high, because the management is quite important. If the sugar levels are too low and you give something that takes it high, if the sugar level is too high and you give something that takes it higher, it can be quite fatal on somebody. And at the time, I didn't even have that small strip that is used to test for that, and that was really frustrating for me, not being able to give the right care to clients, to patients. And that really motivated me to come up with a solution that will be sustainable and help and advance our healthcare system. That is when I was really motivated to start Galafi. And that was the beginning of what the dream. And later on, also, I lost my grandmother. Who we struggled to get the right care for her. And
Was it a matter of because she was in the village, so
villages,
yeah.
yes, yeah. So definitely matter of accessibility in the villages, and just struggling to get the right specialized care for her, and even just waiting times, because if like our grandparents, most of them are not on medical insurance and so forth. So we struggle to even get her the right specialized care, because waiting times, and I think that's something that a lot of families can relate to. Like you may get a waiting time that's 2 years from now.
Yes.
Yeah,
Yes.
which is really crazy, because in that time your disease will progress, and most people actually end up losing their lives during that
before
time.
they actually go to
And
see the
yeah,
specialist.
yeah, because I realized that that's a story that a lot of families actually have gone through and that they can relate to. I was like, how do I start something that will help to bridge that gap, by improving accessibility and making healthcare, not only healthcare, but quality healthcare,
Yeah.
accessible and affordable for a lot of people.
Yeah.
So that is when Galafi was born in 2018. So when I left my government job, I remember a lot of people, even my mom was like, "Are you sure about
What are you
this? What are
doing?
you doing? Like, it's secure, you get all these benefits, what?" And even my colleagues, some of them were like, "Doc, where are you going? Like, yeah, what are you doing?" I was like, you know what, I need to do this. And I quit my job. I didn't have a job at the time. And I came back to Gaborone. I remember I looked up all the private clinics in the city, all of them, and just wrote them down, wrote the numbers down. And I called them one by one, just asking if they have anything part-time, anything. And then one of the calls was a positive one. The doctor was like, yeah, we're actually looking for someone. Please do come in and let's interview you and let's see how you work. So I went in and I was looking for a part-time job at the time.
Yeah.
And I actually got a full-time
What was the plan?
job.
What was the plan?
So the plan for me was to go into private and learn the ropes, learn
Because you
how it
figured
works.
government versus private would be two different animals.
Yes, definitely. Learn and, learn as much as possible and then see from there where I go.
So you knew at that time that you wanted to open something.
Yes.
So
So when I came to know was during like the story that I was telling about just some of the like how overstretched we were at that where I was working. And that motivated me to say I want something where I can be able to not shortchange how I assist you, like not be able, prescribe, I want to prescribe this, but I cannot. In what space can I be able to do that?
So talk to me a little bit about where Galafi is at now, because I think it's grown and you still have plans for more. So very quickly take me through where you are at right now.
So like I said, started in 2018, started with just one clinic, small clinic. And I must say, I need to say that I started with just my savings, that I had savings and I got the bare minimum. I know often when we think of a vision that you have, like, I want to have a hospital.
Yeah, I was about to say,
you
where
want
did you
to
get the
start
money?
at the
Because
level,
the venture, the capital, I mean to say, is a huge barrier.
So as much as I knew I had a dream, you want to start at the level of, you don't want to start at that level. You have to start with what you have, with the resources that you have. So I started with just a small clinic, one table, one chair, one stethoscope, one BP machine, just the bare minimum that would assist me to be able to see a patient without compromising their care. So started with that, and since then Galafi has grown to also have pharmacies, have physiotherapy clinics. We have branches around the city, and recently we've opened our day hospital, the Galafi Day Hospital at Fairgrounds Mall.
We'll talk a little bit more about the Smart Day Hospital. I think you corrected me when I said this earlier. So we'll speak a little bit more about this in just a bit. But you know what? It could be your message, your product, or your service that we talk about right now. So do get in touch and find out how we can serve you and slot you at this point in time. This is Moving Humanity Forward, and we continue in just a bit. Do not go anywhere. Remember, you can find us on Twitter as well as on LinkedIn, as well as on YouTube and Facebook.
We are a healthcare program consultancy company with a deep understanding of the unique challenges facing healthcare systems in low and mid-income countries across sub-Saharan Africa. Our mission is quite simple. We identify critical gaps in healthcare delivery and we design practical and sustainable programs to solve them. And it all boils down to our expertise and our hands-on experience in the global health space. And I deep believe that a healthcare system isn't just about clinics, hospitals, or governments. It includes everyone, from corporate organizations, business entities, community organizations, schools, families, and individuals. That is why our work spans from supporting national health departments or ministries of health to empowering communities with the tools and the knowledge they need to save lives and improve healthcare outcomes. Whether it's training healthcare providers to community members or strengthening emergency response systems and developing life-saving programs, we build sustainable and impactful solutions. We are healthcare system solutions.
Welcome back. This is Moving Humanity Forward. We're talking Galafi Medical. Is it Galafi Medical Group? And as well, Renewal Aesthetics. We'll talk a little bit about that. But you were just about to break down for me what you currently have on the ground and
Yeah.
where you are looking to go. So you've currently got a day hospital with the vision of it becoming a smart day hospital. So I'd like to know where you currently are. And I'm also interested in the model of growth because I think I'm so fascinated and I'm very passionate about let's empower Botswana. Let us take our human resources, develop them to be the world class that we want to get. And I'm also hoping we can cover what I think is very exciting, and that's the idea of Botswana being so perfectly positioned to offer medical tourism, and in that way have us raise up our income and our economy, as the diamond sales go down.
Alrighty. Yes, rightfully said. We just recently opened our day hospital, and it's opening in phases. So first in September 2024, we started with just outpatient medical services.
Okay.
And soon we'll be opening the theaters, the surgical services, where people can come in and be operated same day and be discharged same day. Our model is really a preventative and preemptive kind of model, in the sense that we're not looking to catch you at a point where the disease has advanced to a level where you need more expensive kind of medical treatments. We're looking to first of all catch you before when you are only having the risks, and then be able to treat at a primary healthcare level before, where you need just basic medical interventions.
Okay.
And the third phase would be us now getting into the smart hospital, where we'll heavily invest in technology. And one of the when I spoke about my stories, one of the key problems that we identified was issues of accessibility, and that there's a lack of human resource in terms of doctors and other medical professionals.
Yeah.
So how do we bridge that gap? So we can leverage technology. How do we leverage technology to be able to bridge or solve some of these problems that we have?
Yeah.
One of the things that we've already started with is what we call telehealth or telemedicine, where we can consult you at the comfort of your home over phone, video consultation. This is for very cold cases, or where you are not really in an emergency situation, maybe for a cold, a sore throat, or something very not very urgent. So the doctor will make an assessment looking at your symptoms, is if it's something that you need to come in for, or you can be prescribed medication, and give you all the signs to look out for that will need you to come in to be seen. That improves accessibility. Somebody who's in a place where they're not able to access a medical professional, they can just call in or video call. And
So this is currently being offered.
this is
right
currently
now.
being offered. It was being offered before COVID. The
So
uptake
during
was
COVID as well.
yeah, and during COVID the uptake was quite high,
can
because that time people were confined to their homes.
Yeah.
We also did what we call home visits, where we'd go to people's homes, and that was really I'd say life changing for a lot of people,
Yeah,
because
that's a game
we had
changer.
we had people who could not move to certain areas, and our hospitals were really overwhelmed at that time, and we were able to go to your home and be able to assess you at home and decide whether you need hospital management.
Are you
or we
still
can
offering
care.
that? That
We
sounds
do.
like something
we
that
still
should-
we still offer
Yeah.
home consultations, and a lot of the times we're called for people who are maybe bedridden, cannot move much, but we offer home consultations for anyone, busy executives who cannot. We can
Make
come
the
to your
time.
office,
Yeah.
make the time to move. And then the second level of that is, like I said, a lot of rural areas don't have these medical personnel. So we're looking into what we call a telehealth booth, where you will have that booth with all the equipment that is will be operated by a technician, and you will go into the booth in the rurals. You'll go into the booth, and then a doctor in Gaborone will be able to examine you, be able to tell real time what is going on with you and be
Wow.
able to take action or give an intervention.
So
As
this
to
means that the person who's operating this booth doesn't necessarily have to be a
yes,
doctor. They just need to know
be
how to make the
trained on how
machines
to,
work.
yes, definitely,
Okay.
yeah, like
Because you've got
a
a
technician
qualified doctor
on
who's
the other end.
yeah.
Yeah, definitely. So that is how we're going to expand the reach and, try to bridge the gap of accessibility and a lack of medical expertise. And then the other thing is introducing AI, robotics, smart pills, and things like that.
Okay, I need to pause you there because I need to know what those things are.
Yeah.
But before you do, I just want to say, I always think it's so beautiful because that's clearly you coming from, it's your story. And because you lost your grandmom in this way where she didn't have access, you're like, I don't, nobody else needs to lose their grandmom or mom because they don't have access. And so this solution to me is so personal to you in that sense that,
Definitely.
this was,
Yeah.
I wish I had this then. Let me try and get it in future for
Yeah,
other people.
definitely.
But coming down, you just talked about a smart pill. Yeah, I get it. Or just technology. What's going on here?
So a smart pill would be literally a pill that you swallow, and it's literally it has a camera that will take images as you swallow of your um, GI tract, of your gut system, all the
yes.
way down, and you excrete it, and that will be sent to the doctor. A lot of men right now are afraid of what we call colonoscopies, which is that
I was about to say,
screening
so what is
test.
that replacing?
Yeah, screening test for
Prostate.
for colon cancer
Oh, okay.
is even sometimes can be used for that is different. So a lot of men are afraid to do that, but it's something that is necessary because we are seeing more and more younger men in even late 30s
Yeah.
dying from
Yeah.
colon cancer. And it's something that can bridge that gap to say, okay, just for a screening test, we use this as a screening test. You swallow this just to see if everything is okay, and we can avoid that whole discomfort and people being afraid to access health. But obviously you have all these solutions, and sometimes your community may not be ready for it,
Yeah.
culturally, religious beliefs, and so forth. So over the next few months to a year, we'll just be teaching on what these things are
Yeah.
and how they benefit us. For example, like I said, our model is mostly preemptive, in the sense that we want to be able to do your surgery and you go home same day. Because if you stay in hospital, chances of you getting infections in the hospitals are higher than if it's a day surgery and you go home same day. Recovery rates are much better if it's a day procedure. So even for major surgeries, you can have day procedures for major surgeries if you incorporate technology like robotic surgeries. So it doesn't necessarily mean that you are being operated on by a robot. You are now being operated on by a doctor who's using, it's called AI assisted, who's using a robot to assist them. The doctor is the one who decides what to cut, what, but the robot assists the doctor in that they are doing it fatigue wise, as well as the vision. The surgeon will see much better because of the advanced cameras that that robot uses. And even in terms of opening you up, you don't have to be open up as much as you would if a human was doing it. And in future, you would have technologies, these robotic surgeries, where you don't even have to have that specialist. If you don't have it in the country, somebody can be sitting in the
Yes,
US.
one of the team actually identified or found, shared with us where that is currently happening in other parts of the world, where you have a specialist in a different country,
Yes.
and then I think I think of it as like gaming, where you've got the punching bag or the gloves or whatever,
Definitely.
and then so the doctor is putting their hands in, and this is guiding.
Yes, the
a
robot.
robot somewhere
Yeah.
else. So that's where you're hoping to head.
Yes,
Yeah.
definitely. Because we don't have all the specialists that you can think of in our country. And that's one of the reasons why sometimes your condition may progress because you don't have the right medical personnel who's highly skilled in that area. But
Okay, I have
because
so many questions about that.
we
But go
don't,
ahead.
yeah, because we don't have the skills, how do we bridge that gap? And technology can be one of the things that helps us to bring us.
I read 1984, and I think I have what I like to think of as a healthy respect, fear, caution, but also definitely acknowledging that AI can assist us. So I want to know, in terms of security and safety, just how safe is this invention, and why should that, I mean, you're talking about educating us. Maybe let's give you that platform to educate us on why this is a good thing. Yes, we understand that we don't necessarily have the human resources, especially here available, accessible in Botswana, but is this safe? Can we trust it? How do we know these machines are not going to
Yeah.
take over?
So yeah, that's a really great question. And like I said, I traveled to the US 2 years ago to go and benchmark and see how they are doing things in the US. So you do have regulatory bodies that guide in terms of ethics, what can be done, making sure that these cannot be abused. Because we've seen instances where maybe AI will take me, for example, and call a patient and say, take this medication, and it's not really me.
Yeah.
So there is really like regulatory bodies that help to guide that, just the same way as you have drugs. Like, you cannot just put out the drug. It has to go through a series of tests, and it has to be regulated, and it has to be approved to be able to say, okay, this will not be abused, or this cannot start doing its own thing, and so forth.
Yeah.
So we do have bodies that guide the use of technology in healthcare as well.
Okay. So, in terms of the stages, how many years are you looking at? Because I want to believe, even with the Smart Day Hospital, and you just said something that I wanted to come back to say you go in, get the surgery, and go out. I always thought the time after that recovery period, you needed the medical profession and assistance. How would that work in
Yeah.
this situation where people are coming in, getting the surgery, and going home
Yeah.
same day?
Yeah. So it depends on the surgery. So there are surgeries that are open surgeries, and you have surgeries that are laparoscopic. Laparoscopic meaning you use a scope, a camera. So you just puncture hole instead of opening you up completely. You just puncture holes that go in a camera that will allow the surgeon to be able to operate looking looking at a visual aid instead of opening you up completely. If you're
Okay.
open up completely, you still do need to stay in hospital and be observed and recover. But if it's a minimal, so we call it minimally invasive. It's invasive but very minimal. So if it's minimal, the invasion is minimal to your body, your recovery time is faster. But if you're open up completely, you need to stay in hospital, which is why I was saying our target is for that. We know where we and what things we can do, what things we cannot do. There's still a place for traditional hospitals and for higher care, but our focus is more on to say, okay, even just educating people and getting people to do screening, prevention,
Yeah.
say prevention, instead of going at a point where it's an advanced colon cancer. Come at a stage where you just have the risks, and we monitor you as per, is it annually or what? Instead of getting to a point where your cervical cancer has advanced, you need all these surgeries. Come in at a stage where we do your pap smear, we do other tests, we can do a small biopsy, we can do a treatment that will not necessarily require you to stay in hospital, but it's treating your cancer, so that's our focus, to say, and the cost of that is much lower than if you are treating an advanced medical condition.
Okay. Yes. Well, they do say prevention is better than
Definitely, and cheaper.
Yeah.
Yeah.
So, in fact, I was actually about to ask, and maybe you're answering with that particular mindset to say we really focus on prevention, but it seems like a very big ask to me to say, I want to be, because this is sort of your mission statement. You said, I want something that will be accessible, right? And also just be all over the country. So, also be affordable and have good quality healthcare.
Yeah.
So let's talk about the model that you are implementing going forward in this, and just also the idea of capacitating the human resources that we have in the country.
Yeah. So in terms of the model. So our model is what we call a hub and spoke model, and we're really focusing on primary healthcare. Primary healthcare is just your everyday healthcare, your flus, your coughs, your what, like the basic level of things. And that is where the world is going, to say we need to focus on the base, making sure that you are at a primary level healthy. Okay, you've done all the screenings, you've done all this, and our specialized centers will be the hub where these primary healthcare feed into the hubs.
Okay.
And talking of an issue of affordability, incorporating technology at that level, we traveled to a place called Mayo Clinic. It's the best in the world, and research has shown that it's like the best smart hospital in the world, and research has shown that incorporating technology like that allows you to operate at 20% less than your traditional models. Just the technology will help you to be more efficient. It will help you to have like the patient's experiences to be much better, and even just what's it called, putting all your systems together. It helps you to be more efficient when everything is communicating. You're able to make decisions faster because everything is in real time. You're able to know what works, what doesn't work, and be able to make decisions much faster because of technology. And basically what that is something that allows us to set up ourselves up for medical tourism, which basically means where people travel from a different country to your country because the healthcare there is, first of all, high quality but affordable, you know. Affordable but without compromising quality, and that is where Botswana should be looking into. Let's improve our infrastructure. That's us. We've started with making sure that our infrastructure is of quality, that our clients are coming to a place that is nice. It doesn't feel like you're in a hospital. If you've seen, I don't know if you've seen, you should visit.
I need to visit because I need to know if there's this smell of hospital.
There's no smell
I
like that.
want to know if I'm
Just
gonna
even
walk
to
into
for
Galafi
us, it's very important. Even just to the environment, to the ambience. There's ambient music that's being played to calm you down as a patient. Say, you know, don't worry about whatever is going on with you. We're here to help you. Even just the aesthetic of it. It shouldn't look like you shouldn't feel like you're in a hospital. You feel comfortable.
Because all those other things will contribute to
definitely
even just whatever problem you have.
Definitely
you walk in there, it
does.
smells this way, you're scared.
You're scared.
It
You're seeing
looks
people
not very
gloomy.
friendly.
Yeah.
It's, you know, the sterile kind of, so I can definitely get that. But you've just said something that it reminds me why we invited you here. You're definitely a dreamer because you're saying Botswana can be positioned to be a place where medical tourism takes place, and I just have so many questions. Like, start with how and why, and how and why is that attainable?
Yeah, I think, like I said, it's all about the quality of care and making it affordable.
Okay.
And why Botswana is well positioned. Number one, the stability of Botswana in terms of Botswana is like one of the most peaceful countries in the world.
Okay.
People will be looking to come to Botswana, for example. Accessibility wise, how many countries are like we're landlocked, we think it's a disadvantage.
I was just about to say, isn't that a disadvantage?
Yeah, how many countries surrounding us, and how in terms of population, access to how many people from all these countries, you know. And for the longest time, even our currency has been stable.
Yeah.
Our government is really open to economic diversification, and you know, like right now is the right time. We're looking at diamonds are not doing so well, and what other areas do we look into? Medical healthcare being one of them. It is that one area that bridges all these: tourism, healthcare, and also even technology. It just brings it all together. So for us to get to that level, our tourism industry has to, you know, expand and be of high quality. Our infrastructure, hospitals, clinics, everything has to be of great quality, even just the technology that we have in the country. I even forgot to mention drones as a delivery system for medicines and so forth.
Okay, I
Yeah,
hadn't
so
thought
those
about
are
that. Yeah.
technologies that really could make life much better for us and even just contribute to the economic growth. Right now, we have Botswana leaving Botswana to seek healthcare elsewhere because they don't believe that the quality locally is good. We need to change that narrative and, as Botswana, contribute to that, to making sure that the quality in our country is of great standard.
I want to know how far that dream is from realization, because it seems like if you started in 2018, and more so that you said something that I think is so important, you started where you were, you started small.
With what I had.
Where are you, and how are you, and going to get there, and in what ways can we all come on board and start, having that light
Like,
bulb switched on for
yeah.
us?
Yeah. So, like you rightfully said, Kefi, it's very important. Like, I think a lot of people, young people find themselves in a situation where they're paralyzed because they have this vision, this dream that they want to do. They don't have the funds for it. They don't, but the problem is that we think of it as that big dream or where we want it to be. We don't think of it, okay, where can I start? Can I just start with a prototype? Can I just start with just one small thing? Can I start from my house? And things like that, and just keep reinvesting and making people see the progression. Because sometimes when you have a big vision, like in my 20s when I was still talking about it, going to some of the offices, people were like, hey, kore ngwano a re o batla go ira eng tota, and but showing them that this is possible. And one thing I didn't speak about is that when I started with Galafi, we're not allowed to have more than one clinic. And I did it, found a way of doing it to say, okay, can I bring other people who have licenses to be able to do more than one? Because it's not allowed. But now that has changed. It's now allowed. Other people who are coming after me are able to open more than just one facility. So it's very important to start. I don't know if I answered the entire question.
You know what? I like to call myself a village girl, and I want to call you a village girl
I
to say
am.
the village girl from Marapong had a big dream and she made it happen. I think you should have your big dreams as well. This is Moving Humanity Forward. Don't you go anywhere. We are right back in just a bit.
Life comes with surprises. Some good, some not so much.
But whatever happens, you can face it head on.
Assure Wealth gives you more than just insurance. We give you protection for every part of your life, your home, your car, even your travel.
We help businesses stay resilient with commercial covers from theft, fire, public liability, and group covers.
Got a team? We've got you covered too. Life cover, disability, funeral schemes, even income continuation.
Our type of funeral plan is just one way to ensure dignity and peace of mind.
Need cover for travel?
Done.
Aviation, agriculture, even political riots.
We've got you.
Professional indemnity?
Of course.
At Assure Wealth, we are not just brokers, we are your insurance partners for life.
Insurance that protects what matters. Insurance done right.
Welcome back. This is Moving Humanity Forward, and we have a diamond baby with us today because really it is our education system that took her through her entire training. In Botswana, we always knew that if you were doing medicine, you do the BSc, the Bachelor of Science, the Part 1, the foundation, and then the government sends you outside the country. But the batch that Dr. Matlhogonolo was in didn't get to leave the country, but she says, hey, listen, 80 doctors a year, that's what they were training out at the time. And I mean, just look at the results that this particular diamond baby has put out. You talked a little bit about we were only allowed one clinic, and now we've got a dream and a vision of putting clinics all around. Speaking of some of the things that you've done, Renewal Aesthetics is something that I don't know if I ever envisioned that we'd have it here in Botswana. I think growing up, we always had this mindset that aesthetic medicine is just, it's cosmetic things. You don't really need it.
Yeah.
You know, it's not really necessary.
Yeah.
But I want to believe that this is a passion of yours. And so Renewal Aesthetics was born out of it. Talk to me a little bit about that. And in fact, let's start off with, how serious did people take you? I kind of feel like sometimes there's the level of judgment. You know, type of thing.
Yeah. So I'd start with this. I think the definition of healthcare or health, like, it's not just the absence of disease, that you don't have a disease.
Yeah.
It's actually your mental, physical, social, spiritual well-being. I get it. So Renewal Aesthetics really taps into the social well-being as well as to, we believe that if you look good, you feel good. And if you feel good, you do good, even in your workplace, wherever it is in your life, right? So how Renewal Aesthetics came to be also was just, personal journey. As an entrepreneur, it can really strain you, burnt out. And I was like, you know what? I need to take care of myself. So I took time off. And I was off for 3 months off of work in 2021. And during that time, I got to realize, it's very important to fill your cup, do things that really, fill you, do things that really make you happy and all of that. So that is how Renewal Aesthetics came about. So we are an medical aesthetics company that bridges the gap between beauty and science, and everything that we do is evidence-based. And we believe that a human being is not just, or health is not just physical and mental. It's just you as a whole, as a person. What makes you happy? What doesn't make you happy? And is there a way that we can, help enhance or correct or improve that. And
Okay, so there's a level of thinking that says aesthetics are just there for vain people, right? So you are saying, listen, I mean, and we all know this, I think, especially as women, because there's that pressure to look a certain way. If you're a woman that had acne in your teenage years, you know what you're talking. We know what you're talking about.
Definitely.
I had bad acne, and it will mess with your self-confidence.
Definitely.
And you will not want to be in the front of anything. It will take a whole lot for you to then stand in front of people with confidence.
Definitely.
Right? So I definitely get it as somebody who went through that, right? Lunch bar phase. Like that, I still remember it. How many years decades later, right? But that level of is it really necessary? Is it vanity versus necessity? And also just take me through some of the procedures that you offer, even as you speak to that.
Okay. So most definitely, a lot of the clients that I see, it's actually real problems that they've had from childhood. And speaking of acne, I've had many patients or clients who struggle with that and would have childhood traumas. I remember some client was telling me how sometimes he would get some of his classmates popping his pimples, and that has caused him to have really bad scarring. And even now, when he doesn't have the acne, he still sees himself that way. And you're definitely right that it takes away a lot from you. I have women who've gone through pregnancy and have what we call postpartum hair loss, and it's one of the treatments that we do. We have people who cannot go without makeup. Sometimes there's a lot of judgment. People will be saying, hey, you're not really the wiki hair. You don't know that what's going on underneath. They're struggling with alopecia. They don't know where to go, what treatments are available for them. You have somebody who's...
alopecia is when you start
alopecia basically
your hair?
means hair loss.
Oh, okay.
So it's a medical term for hair loss, and there's different types
Okay.
and different causes. Yeah. So some people it's because of pregnancy, some people underlying medical conditions, some people it's because of some of the hairstyles that they did, and so forth. And you have people who are always putting on makeup. You think, okay, this person likes makeup. Why can't they just, and you don't understand that they went through something that they are hiding. And one of our tagline at Renewal, it says enhance, restore, unmask your best self.
Wow.
Meaning that like we want you to unmask, wear makeup because you feel like it, not because you're hiding something or you can't face the world without it. And I do have clients like that. So that's what we do at Renewal Aesthetics. And speaking of whether it's vanity versus necessity, yeah, sometimes it's okay, even if it's for, it's in the pursuit of vanity. Like sometimes it's okay, it's what you like, it's what you want. But obviously, as a medical professional, I also need to be able to assess whether this is really coming from a good place, because I like to look this way. I don't want my wrinkles to show, because people think I'm always angry. Like some of the executives that I see, they're like, yo, I need to fix this frown line, because now people think I need to be approachable, for my work. But as a medical professional, I need to also be able to pick up when there's an underlying psychological issue that is maybe the reason for that. Because there's also issues of body dysmorphia, where somebody is not really happy with how they look, and it really depresses them, gives them anxiety, and they are just fine, in a sense. And it's for me to assess that and look at the underlying issue and try to address that before I give you something that is not necessary for you.
I want to actually talk to that, to say ethics, versus profit. Bottom line is, at the end of the
Bottom
day,
line.
you want to make money.
At the end of the day, yeah.
But before we get to that, talk to me a little bit about some of the procedures that you offer. And if you can just touch, not all of them, but just some
Okay.
of them, on why you thought, you know what, this one I need to make sure that I have it in there.
Okay. So some of the procedures, so in terms of conditions that we treat: acne, hyperpigmentation, ditubara, black spots, acne scars, aging. Some people age faster than their actual age because of certain things. Some people just want to age gracefully. How do I make sure that I age very well? Like, one of most important thing that I always say to people is sunscreen all the time. 80% of our aging comes from the sun.
Yeah.
So if you're not sunscreen, that's something that you can teach your
And she's
your
just
teenage,
said, by the way, that to all of
even
you
the
who are going
lights.
to work in a podcast, the lights here
Yeah.
need us to have sunscreen.
Yeah, and also how do you, like, just knowing how to advise your teenager who and how they should not go through the same things, with knowing what to use. Because most of the time you've gone through all sorts of products, scrubs, black soap, what, and you don't know what to use. So some of it is just educating our people as well. We do the treatments that we do chemical peels, we do facials, medical grade facials, not just the basic facial, a facial that actually is going to address your problem. They have what we call active ingredients. We do microneedling, which is a really nice procedure for a lot of these conditions. We do Botox, we do filler, we do hair restoration.
What's filler?
Filler is it's a injectable that is used to just fill up space or volume, to increase volume.
So wait, is that for the cheeks?
So some people use it for the cheeks. You can use it to treat different things. Some people use it for the cheeks, for the chin. Sometimes you can have those deep lines that need to be filled. Sometimes you can have a scar that can be used to.
Filler can be used to treat a scar.
Yes.
Okay.
Yeah. So also a big one that I'm seeing is hair restoration. We do microneedling. We do what we call platelet-rich plasma, which is where we take your own blood, we put it in a machine, spin it, and we inject on the scalp to stimulate the hair follicles.
Wait, can that work for men as well?
Pandlani, yes. So it depends. So for a lot of men, that pandlani, the only treatment is hair transplant, which we'll be offering very soon.
Okay.
Yeah.
Okay, so those are...
and other medical, you can take tablets. There's tablets that you can take. There's things that you can apply on the scalp. So when you come in, we discuss, I educate you on what's going on with you, and I'll give you options to say, okay, these are the options. Yeah.
I noticed you haven't mentioned BBL. Is that coming? Is that on the to-do list? Like laser, the transplant of hairs.
Yeah,
that's
it's coming
soon.
So
BBLs?
that will definitely come with the hospital. The second phase is surgical treatment, the surgical department. So you'll have all different types of surgeries, including plastic surgery as well.
Okay.
Yeah.
So for now, you don't have plastic surgery.
So
I
for
can't
now, we
come and get a skinnier nose.
No, not yet. Yeah.
But soon.
That's the
plan.
Yeah. Before the end of the year.
Before the end of the year?
Yeah, definitely.
Wow.
So the theater, everything is ready. We've been inspected. We're just waiting for the regulatory processes to be complete, and we'll be starting.
Wow.
Yeah, we actually will be having our official opening sometime this year, towards the end of the year of the hospital.
Oh, Moving Humanity Forward wants to be there. Okay, let's talk a little bit about profit versus ethics, because honestly, I think, and we were talking about this earlier, to say, as a human race, we we always find those loopholes there and there.
Yeah.
But you were saying that's why it's so important to see who is doing these treatments.
Yeah.
So talk to me about what you have done to make sure that you have these balance and checks in place.
So, as a medical professional, I take an oath, right? Which says, first, do no harm.
Yes.
I'm not going to do anything that is going to harm you. And for me, and my clients can attest to this, I do things that are based on evidence, right? So that's the ethics part of it, to say, is there evidence for this thing? Is it necessary? Is it allowed to do this thing in an 18-year-old as well? And I do a lot of education to my clients, and it's very important to know the person who's treating you or who's doing your procedure, what qualifications they have, because all these things, as much as they are minimally invasive, they can have detrimental aftermaths or adverse effects, So it's very important to know if the person who's doing your procedure is well trained, they know what they're doing.
But how do you check that? And how do you know? Because there's so many stories that we hear of people going through that, and yes, you see the certificates, but 10, 15 years later, so many botched operations later, and then it turns out those certificates were fake. How do I, as just a normal person off the street, how do I check that this person is legit?
Yeah, I think number one is the certificates. At least if you can get that, that's the first thing. You can also ask to see work that they've done, but also that's tricky because you can get somebody else's work as if it's their own.
Yeah.
But I'd say you'd rather trust the medical professional, because as much as there are people who pose as medical professionals, I think it's a bit safer.
Especially somebody who's taken the Hippocratic
oath. Yeah.
All right. I don't know if there are any last words that you want to give us before you part with us, but what I do want you to do is actually speak to especially that person, and I don't even want to say kid at this point, because we see in Botswana where we have a lot of underemployment and older people losing their jobs. But speak to that person, especially that one in a rural setting who's got just this big dream. Talk to them.
What I'd say to them is that your background doesn't define where you're going to go. It doesn't matter if you didn't go to private school or whatever, you are not privileged in a sense. As long as you have a dream that you believe in, and you have to believe in it first before anyone else can believe in it. And the most important thing is to start with what you have. wherever you are. Just start somewhere, something, and you need to build that traction so that people can start believing and seeing, because a lot of the times people don't believe in dreams and visions if you don't show them something, if you don't show them your commitment, if you don't show them a track record of your work and what you've done. And progress over perfection, really. Like, I know sometimes we want things to look a certain way to, but as long as you're making progress, that's the most important thing. And for somebody who's already started, and I know how tough entrepreneurship can be, just know that it's really just breaking down the weaker version of you so that the stronger version of you can emerge and, take on that dream.
I'm definitely taking those words with me. She says, just know whatever toughness you're going through, it's breaking down the weaker version of you so that the stronger version of you can go on.
Yeah.
I love that. We're going to close on that. This is Moving Humanity Forward. And from these village girls to you, it's been absolutely lovely. Do remember to like, to share, and to subscribe. You find us on LinkedIn, you find us on YouTube, and you find us on TikTok by typing Moving Humanity Forward Podcast. And then on Facebook, you type MHF Podcast. My name is Kathy Malajani. We'll see you next time. Welcome to Moving Humanity Forward. My name is Kathy Malajani. You can call me #CuriousCat because you know what? I always have so very many questions. I think the big question that we're really looking to is where to next after we take a look. Oh, why are you cutting me? Why are you cutting me?
The energy, mommy.
Hey.
The energy.